Alaimo, and Katherine is Associate Professor of Food Science and Human Nutrition. And Luke, I need to get the clicker from you, and we need to advance. We're ready to advance the slides, and it's just the arrows. Katherine, and I just heard both Katherine and all of our presenters this morning, please stay somewhat close to this microphone here. If you wander too far away, nobody will hear you. So try to stay close to the microphone. All right, thank you, Katherine.
Good morning. I'm so pleased to be here. Thank you, Rich, for inviting me. I'm going to share with you a little bit about my research program and a new study that I have starting up in January. And the title of my talk is Starting from the Ground Up. So we know that cardiovascular disease, cancer, and diabetes are leading causes of morbidity and mortality in the U.S. and worldwide. And the Centers for Disease Control and Prevention estimates that more than 75% of healthcare costs are due to these chronic diseases. We talk about the obesity epidemic causing these chronic diseases, but I like to cut right to the source and talk about our poor nutrition and physical inactivity epidemics that we are facing. Besides smoking, diet and physical activity are among the most important prevention mechanisms that we have. And we now know from randomized clinical trials that a plant-based diet and physical activity can prevent, treat, and even reverse chronic diseases like heart disease and diabetes. We also know that changing health behaviors is incredibly difficult. More than 95% of weight loss diets fail, with the participants either gaining back the weight that they lost or gaining back even more. So a primary question in public health remains, how can we design comprehensive community-based interventions that encourage diverse people to eat more plant-based foods and be physically active? And how can we design them in such a way that they're scalable, sustainable, and attractive to people? But wait, what if this kind of comprehensive intervention already exists? And what if, in addition to encouraging people to be active and to eat better, it also has the potential simultaneously to improve mood, increase social support, generate social capital and intergenerational relationships, provide a sense of community, prevent crime, increase property values, and even has the potential to sequester carbon from the atmosphere.
Oh, wow.
I've been studying community gardening for over 15 years now, and I'd like to share with you the magic that I have seen with gardening as a mechanism to improve health behaviors, and also share with you a little bit about the new research study that I have designed with colleagues at the University of Colorado Boulder, Colorado School of Public Health, Colorado State University, and the University of South Carolina to test our theories. So what is a community garden? It's land gardened collectively by a group of people, and there's many different models for this. From the lot-based systems that we see here in Lansing, where neighbors are gardening side by side on lots that have been assigned to them, to the community farms that we see in Detroit, where neighborhoods are growing collectively fields of produce. What many people don't realize, however, is that a community garden is also a serious and significant public health intervention. My colleagues and I like to call it a comprehensive, multi-component, behavioral-based, socio-environmental intervention.
Wow.
And what are those components? A community garden is, unlike many standard health interventions, things like classes, media campaigns, and doctor's visits, community gardens provide a tactile, aesthetic, fun, economical, and easy nudge that decreases barriers and provides opportunities. A place to be active, vegetables in your refrigerator, self-efficacy to practice health behaviors, and social connections to enhance and sustain behavior change. Of course, we know that gardening is not for everyone. What does it take? It takes interest, it takes time, and it takes space. However, the use of gardening as a health intervention builds upon one of America's most popular activities. More than 75% of U.S. households participate in do-it-yourself lawn and gardening activities, and more than a third of U.S. households have a food garden. Community gardens are relatively low cost for communities and families, which is especially important for those who may face economic or structural barriers to fresh produce. And if you care for the soil, a very small investment can yield hundreds of dollars in produce over the growing season or even more. So what are the components of these community gardens? It's a green, beautiful place that produces food and places to be active, provides a space for social connection, and turn an unused and unowned piece of property into a used and owned place that's important for crime prevention, helps neighbors generate collective action, and in some cases can provide income for the participants, and many gardens also have youth programming. These components are associated with multiple benefits. Through cross-sectional and qualitative studies that my colleagues in Colorado and I and others, and I have done with partners here in Michigan and others have done in other cities around the US and worldwide, we have determined that after adjusting for demographic, socioeconomic, neighborhood conditions, community gardeners eat fruits and vegetables on more occasions in a day, are more active, weigh less, are more socially involved, and feel more social support than non-gardeners. While these results that we have found are encouraging, the work that's been done thus far has been primarily cross-sectional and qualitative. And we've heard from practitioners in the field that they would appreciate a randomized controlled trial in a medical model to be able to convince funders with compelling evidence that they should continue support for community gardening. The qualitative data can be dismissed as anecdotal, and the cross-sectional studies do not provide proof of causation. For example, it may be that gardeners already liked vegetables and were eating more of them before they started gardening, not the other way around. So a randomized controlled trial is necessary to demonstrate our overarching hypothesis that giving a non-gardener a garden can change their health behaviors. So I'd like to tell you about this new study that has just been funded by the American Cancer Society. It starts up in January. Jill Litt at the University of Colorado and I have worked together for many years to get this study funded. While I have been doing participatory research in Michigan with gardeners, Jill has been doing participatory research with gardeners in Denver, and we've had parallel research programs, and we're really excited to be able to come together to work on this study together. Our community partner in Denver is Denver Urban Gardens, and we have a really exciting opportunity working with them that we don't actually have here in Michigan. In Michigan, there is so much space available, especially in urban areas, to garden, that it's hard to design a natural experiment where you can randomize people to garden or not garden. On the flip side, in Denver, space is a premium. And their 150 community gardens have very long wait lists. And so we have proposed and have designed a study to randomize people off of their wait lists to either receive a community garden, an available community garden plot in a particular year, or to remain on the wait list, which is the natural condition of what would have happened to them anyway. Over at 3 time points, prior, during, and at 1 year follow-up, we're going to measure diet, physical activity, body composition, and do a health questionnaire. And our aims are to determine whether community gardening leads to an increased intake of fruits and vegetables, reduced sedentary time, increased moderate to vigorous physical activity, and reduced age-associated weight gain. And we're also interested in the mechanisms for this action. How do we think this works. Through our qualitative work, we have seen that there's something special about getting your hands dirty, watching a plant grow, nurturing a tomato, and having vegetables magically appear in your refrigerator that can produce a powerful reaction that many other health interventions do not, as I said before. We've learned that community gardens provide a personal, social, and environmental wraparound to the person that lead to multiple outcomes, increasing not only health behaviors, but the enjoyment of those health behaviors that is so important to their sustainability. It may be that the most important part of a community garden as a health intervention is that people don't feel like they're in a health promotion intervention. They're just doing something that they love. So to conclude, for the first time, we have the opportunity to determine if a community garden can change health behaviors, and I look forward to sharing those results with you in a few years. In the meantime, I encourage you to grow a garden wherever you are and to share it with others. It may just improve your health. And I'll leave you with some quotes from a qualitative study I conducted with HYPOTHESIZED in Detroit a few years ago, and I'm happy to take questions.
Just to remind the audience how we're doing this, both in Zoom and we're monitoring the questions. We're going to be able to do maybe 2 questions. We actually have 2 questions. Katherine will read the question and then provide a response. For the audience here, and Anthony, as we do more of these presentations, please try to write your question before the end of the presentation again, so we keep the flow of this going. So we have 2 questions, one from Zoom, one from the audience here, and if you repeat the question and answer them, and you can keep them as souvenirs.
Okay. This question is, are the same benefits available for home gardeners or just those who engage in gardening in a collective setting? And this is an excellent question, and my colleague in Colorado actually asked that question in a survey that she did with Denver gardeners. And she found that in vegetables that there was actually a gradient so that home gardeners ate more fruits and vegetables than non-gardeners, and that community gardeners ate even more. As I said, with our model, we think that there is a direct impact of gardening itself on health behaviors and those health impacts, but we think that it's more enhanced when you're in a community setting. So the answer is yes, you can get these benefits from gardening, in your home and by yourself, but that we believe, or our hypothesis is that you get more bang for your buck, essentially, when you're gardening with others. The next question is the study only in Boulder, not Michigan? The study is actually only in Denver. And as I said, we had this great opportunity in Denver to work with Denver Urban Gardens, who already has a wait list for us. Dr. Litt and I have been working for many, many years to get this scientist study funded, and our original design was to work in 6 cities, including Detroit, Denver, and several other cities around the country, because we didn't believe that we'd be able to get the sample size that we needed in any one city. But because community gardening has exploded in Denver, we now have the opportunity to simplify the design and do the study in just one city. And so that's why this is. Thank you very much.
Thank you very much.